Before you view our video, please take a moment to subscribe to our YouTube channel by clicking the subscribe button, then tapping the bell icon so that you will be the first to know when we post new videos.
10 silent signs you might have diabetes. New studies show a shocking 25% of people with type 2 diabetes don't even know it. If you experience some of these subtle signs and symptoms, talk to your doctor about getting tested. Diabetes has plenty of early signs, but they're subtle enough that you might not notice. The longer you go without controlling diabetes, the greater your risk for heart disease, kidney disease, amputation, blindness, and other serious complications. Here are diabetes signs and symptoms. 1. You're taking more bathroom breaks. When you have diabetes, your body becomes less efficient at breaking food down into sugar, so you have more sugar sitting in your bloodstream. Your body gets rid of it by flushing it out in the urine. That's why you're going to the bathroom a lot. Most patients aren't necessarily aware of how often they use the bathroom. But one red flag is whether the need to urinate keeps you up at night. Once or twice might be normal, but if it's affecting your ability to sleep, that could be a symptom to pay attention to. 2. You're thirstier than usual. Urinating a lot will also make you feel parched. A common symptom with patients is that they use drinks like juices, soda, or chocolate milk to quench their thirst. These sugary beverages then pack the bloodstream with excess sugar, which can lead to the problem all over again. 3. You've lost a little weight. Considering that being overweight is a risk factor for diabetes, it sounds counterintuitive that shedding pounds could be a sign of the disease. Weight loss comes from 2 things. 1. From the water that you lose from urinating. 2. You lose some calories in the urine and you don't absorb all the calories from the sugar in your blood. Once people learn they have diabetes and start controlling their blood sugar, they may even experience some weight gain. 4. You feel shaky and hungry. It's not uncommon for patients to suddenly feel unsteady and immediately need to reach for carbs. When you have high blood sugar, your body has a problem regulating its glucose. If you've eaten something high in carbohydrates, your body shoots out a little too much insulin, and your glucose drops quickly. This makes you feel shaky, and you tend to crave carbs or sugar. This can lead to a vicious cycle. 5. You're tired all the time. Of course you're exhausted every now and then. But ongoing fatigue is an important symptom to pay attention to. It might mean the food you're eating for energy isn't being broken down and used by cells as it's supposed to. You're not getting the fuel your body needs. You're going to be tired and feel sluggish. But in many cases of type 2 diabetes, your sugar levels can be elevated for a while, so these symptoms could come on slowly. 6. You're moody and grumpy. When your blood sugar is out of whack, you just don't feel well, and might become more short-tempered. In fact, high blood sugar can mimic depression-like symptoms. You feel very tired, you don't feel like doing anything, you don't want to go out, you just want to sleep. She'll see patients who think they need to be treated for depression, but then experience mood improvement after their blood sugar normalizes. 7. Your vision seems blurry. Don't be alarmed, this is not diabetic retinopathy, where the blood vessels in the back of the eye are getting destroyed. In the early stages of diabetes, the eye lens is not focusing well because glucose builds up in the eye, which temporarily changes its shape. In about 6 to 8 weeks after your blood sugars are stabilized, you're not going to feel it anymore, the eye will adjust. 8. Your cuts and scrapes heal more slowly. The immune system and the processes that help the body heal don't work so well when your sugar levels are high. 9. Your feet tingle. Elevated sugar levels can cause complications well before you realize you have diabetes. One of these is mild nerve damage, which can cause numbness in your feet. 10. You're more prone to urinary tract and yeast infections. Higher levels of sugar in urine and the vagina can become a breeding ground for the bacterial and yeast that cause these infections. Recurrent infections are particularly worrisome. Usually when you keep getting infections, doctors will check for diabetes if you don't already have it. Even women who go to the emergency room for urinary tract infections are often checked.
If you liked the video, give it a thumbs up and share it with your friends. For more recipes and tips, subscribe to the channel.